Are you worried because you have pain in your joints and are unsure of how to diagnose and treat it? First, you must know that this stiffness or severe joint pain is known as osteoarthritis. It's a common form of arthritis. It is unrelated to the specific joint. It can affect any joint of your body, either the knee or hip. According to a World Health Organization report, 528 million people worldwide were affected by osteoarthritis in 2019. Usually, older people are more affected by this disease. The main risk factors that cause osteoarthritis include age, obesity, gender, weak muscle, genetics, joint injury, abnormal joint structure, and environmental factors. A patient with osteoarthritis experiences various symptoms, including joint pain and stiffness, especially when moving after resting. Sometimes, joint swallowing occurs in some patients at a worse stage. Hands, knees, hips, feet and spines are usually affected by osteoarthritis. The worst osteoarthritis complications may lead to chondrolysis, sleep disruption, anxiety, depression, and pinched nerves. This disease is diagnosed by a physical exam and medical tests such as X-rays, MRIs, and joint fluid analyses. If a person is affected by osteoarthritis disease, how does he get treatment? Don't worry. In this video, we will explore its treatment and precautions at an early stage to avoid it getting worse. Let's get started. What is osteoarthritis? Osteoarthritis is a type of arthritis that occurs when the cartilage of your joint lining is worn down gradually or damaged, and as a result, bones rub against each other, which causes pain. Cartilage is a lubricant that helps the bones of joints move smoothly. The cartilage and tissues that protect your bones wear out in this condition. The body parts affected by osteoarthritis include hands, feet, knees, ankles, and spine, the lumbar spine, which means lower back, and the cervical spine, which means neck. Types of osteoarthritis. There are two types of osteoarthritis. Primary osteoarthritis is a condition that develops gradually throughout your life. The second type is secondary osteoarthritis, which happens suddenly when your joint is damaged due to any accidental injury or trauma. This disease affects different people differently. Some people experience mild pain. Others swerve. Some feel it all the time after any scheduled work, and others feel this pain for a while. Osteoarthritis affects females more than males. A prevalence report by the World Health Organization indicates that about 60% of patients with osteoarthritis worldwide are female. It also represents 344 million out of the 528 million who have knee joint issues. How does osteoarthritis happen? It is unknown when the tissues of a joint are broken down, but as osteoarthritis starts, it can damage cartilage, tendons, ligaments, and synovium, which is the lining of the joints. As this damage happens, a patient feels pain, stiffness, and even the loss of joint motion, leading to muscle weakness and lowering activity progress. Causes of osteoarthritis. As discussed earlier, aging is the fundamental factor that causes this disease. Usually, 50 years old people are affected by this disease. The second leading cause of this disease is obesity, as obesity is the mother of all diseases. It is also the foremost cause of joint diseases. Being obese, you need to know that excess weight stress and pressurize the joints and promote inflammation. The third cause is if your muscles are already weak and do not support your joints enough. This disease happens in males and adults, but its highest ratio is observed in females. It's also a genetic-specific disease. People with siblings or parents with osteoarthritis are more likely to have this disease. Some environmental factors also count in this disease, such as your level of physical activity, working style, diet, and bone density. Symptoms exhibited by osteoarthritis patients. People affected by this disease usually experience the following symptoms: pain or aching the joint during any activity, or, in some people, feeling that pain at a resting state as well. Sometimes, joints stiffen after doing any physical activity or after resting. A cracking sound when a joint bends. The surrounding muscles of the joints become weak. Joints in some places become unstable. Complications of osteoarthritis. The stiffness and pain of joints lead to limited joint motion that disturbs your sleeping process at night. This uncomfortable situation causes intensified pain. Due to pain or stiffness of joints, you rest every time and cannot do your desired work. As a result, you may gain weight. Due to osteoarthritis, people's exercise routines are also disturbed, which leads to weight gain. This extra weight then leads to other chronic diseases such as diabetes, hypertension, and heart disease. The pain of osteoarthritis symptoms negatively affects mental health. About 40% of anxiety and depression are a result of osteoarthritis. Osteonecrosis, a condition in which bone cells are damaged or destroyed, is also the result of complicated osteoarthritis. A complicated osteoarthritis of the spinal cord may lead to pinched nerves. This condition occurs in the last 5 vertebrae when excessive pressure is developed on the nerves of these vertebrae. Diagnosis. When you go to your doctor, he will first take a medical history from you, in which he will ask some questions such as, what is your age? Do you have any family ties related to osteoarthritis? Is your joint pain worse or normal? It happens all the time or after doing any activity. Stiffness occurs in the morning or after half an hour of resting. After taking the history report, he will take some tests, such as joint aspiration. It is a type of examination in which a doctor inserts a needle in your joint to pull out fluid to look for infections or crystals in the fluid and to roll out other forms of arthritis. X-ray. It shows you any damage to the joint or bone. MRI or magnetic resonance imaging. This radiology test gives a better view of the cartilage. Treatment. There is no proper treatment for this disease, but some precautions and medications can save you from further damage or falling. Medication. Anti-inflammatory and pain relief medicines are available as pills, gels, creams, or syrups. These include analgesics, such as acetaminophen, non-steroidal anti-inflammatory drugs, such as ibuprofen, counter-irritants. These medicines contain ingredients that irritate the affected nerve endings and cold, then warm the painful area and give relief. Corticosteroids. These are anti-inflammatory medicines that work just like hormones. Precautions. As directed by your doctor, engage in strengthening, balance, or aerobic exercise. By exercising, joint movement can relieve stiffness and strengthen joints. Lose weight. Wear a shoe that gives you relief and stabilizes your joints. Apply some heat, cold, or complementary therapies. If you are experiencing osteoarthritis and want to take any medicine or preservative measure, please talk with your doctor first. If you enjoyed this video, don't forget to like, share, and subscribe to our channel for more captivating content. And as always, stay curious and keep exploring.